Welcome to the exercise classroom, anatomical, biomechanical, and practical exercise education. Today's lesson, the side bend. Introduction. The side bend is a classic isolation exercise that targets the muscles of the lateral core, specifically the obliques. This movement is typically performed with a dumbbell or kettlebell in one hand while standing upright. While simple in form, the side bend offers a powerful means of improving core symmetry, lateral stability, and torso mobility. It is also referred to as the dumbbell side bend or standing side bend, and its emphasis on unilateral contraction makes it ideal for addressing imbalances in core strength and control. Body contour benefits. Side bends contribute to a more defined waistline by directly activating the oblique muscles on each side of the torso. Consistent performance can enhance the visual taper from the ribs to the hips, supporting a sculpted appearance and improved side profile definition. Additionally, stronger obliques contribute to overall posture and can reduce the appearance of lateral bulging caused by weak trunk musculature. The movement. Joint action. The primary joint action in the side bend is lateral flexion of the spine, particularly through the thoracolumbar region. The exercise involves bending the torso sideways in the frontal plane while maintaining a neutral spinal posture. Functional benefits. Side bends enhance lateral spinal mobility, contribute to core balance, and improve anti-rotational control. This translates into better movement efficiency during daily tasks involving side reach, rotation, or single hand lifting. Athletes in sports that require quick changes in direction or trunk rotation also benefit from strengthened obliques and lateral stabilizers. Exercise execution. Stand tall with feet shoulder width apart. Hold a dumbbell in one hand, allowing it to hang naturally at your side. Keep the opposite hand placed lightly behind the head, on the hip, or extended to the side for balance. Maintain an upright spine and engage the core. Inhale and slowly bend at the waist toward the side holding the dumbbell, moving only through the lateral trunk. Keep your chest upright and avoid leaning forward or backward. Pause briefly at the bottom of the movement without letting the dumbbell rest on your thigh. Exhale and contract the oblique muscles on the opposite side to return your torso to the starting upright position. Complete the set on one side before switching the dumbbell to the other hand. Proper technique. Maintain a neutral spine and avoid twisting or leaning forward. The motion should be isolated to the lateral flexion of the spine. Range of motion. The movement should span from a vertical torso position down to a controlled lateral flexion toward the side, ensuring the dumbbell slides down the outer thigh without passing the knee. Return to the upright position without bending forward or backward. Common mistake. The most common mistake when performing the side bend is allowing the torso to twist or rotate forward, which shifts the movement away from the obliques and onto the lower back, increasing injury risk. Muscle mechanics. The side bend begins with activation of the obliques to initiate lateral flexion. The internal and external obliques contract concentrically to bend the torso sideways. At the bottom position, a brief isometric hold may occur before returning upright through eccentric control by the same muscles. The spinal erectors assist with stabilization throughout the movement, while the quadratus lumborum supports both sides during the bend and return. Primary movers. The external obliques and internal obliques are the main muscles responsible for lateral flexion of the spine during the side bend. They contract unilaterally to bend the torso toward the same side of the working muscle, contributing to both motion and torso definition. Other muscle roles. The contralateral oblique muscles act as antagonists, providing controlled resistance and stabilizing the trunk against overflexion. The quadratus lumborum and rectus abdominis assist as synergists with spinal lateral flexion and core support. The erector spinae, transversus abdominis, and gluteus medius function as stabilizers, maintaining posture and balance as the body bends to the side. Biomechanical considerations. Frontal plane motion. The side bend involves spinal lateral flexion in the frontal plane. Proper alignment prevents unwanted spinal rotation or forward bending. Unilateral core activation. One side of the trunk contracts concentrically during the bend, while the opposite side controls the return eccentrically, promoting balanced strength. Pelvic control. Stabilizing the pelvis avoids shifting or twisting, helping isolate the obliques and quadratus lumborum effectively. Load placement impact. Holding weight in one hand increases core activation on the opposite side. Cable versions offer consistent resistance through the range. Training effectiveness and optimization. Controlled range of motion. Avoid excessive bending to the side or rotating the trunk. Stay within a natural arc to isolate the obliques and minimize spinal strain. Unilateral loading strategy. Performing the side bend with resistance on one side increases engagement of the contralateral oblique and quadratus lumborum for improved asymmetrical core strength. Slow and steady tempo. Executing the movement with a slow, deliberate descent and controlled return amplifies core activation and prevents momentum from reducing muscular effort. Breathing rhythm. Exhale while bending sideways, and inhale as you return to upright to maintain intra-abdominal pressure and enhance spinal support. Safety and injury prevention. Avoid overextension or twisting. Do not hyperextend the spine or rotate the torso while bending sideways. Keep the movement strictly in the frontal plane to reduce risk to the intervertebral discs. Neutral neck alignment. Keep your head aligned with your spine throughout the motion. Avoid tilting or dropping the head toward the shoulder to prevent strain on the cervical spine. Proper load selection. Use a weight that challenges the obliques without pulling you into uncontrolled lateral flexion. Excessive resistance can overload the spine and compromise form. Brace the core. Engage the core muscles before initiating movement. This helps stabilize the lumbar spine and prevents compensatory movements from the hips or shoulders. Variations and alternatives. Dumbbell overhead side bend. This variation increases the lever arm and challenges the obliques through a longer range of motion, emphasizing shoulder stability and lateral control. Barbell side bend. Holding a barbell across the upper back increases axial loading and demands greater core control, particularly through the obliques and spinal stabilizers. Barbell landmine side bend. By anchoring the barbell in a landmine setup, this variation allows for a controlled arc of motion and targets both obliques and the deeper spinal stabilizers. Bodyweight side plank with hip drops. This no-equipment option works the lateral core muscles isometrically and dynamically while improving trunk stability and reducing spinal loading. Mastering the side bend enhances lateral core strength, improves trunk stability, and contributes to balanced development of the obliques and spinal stabilizers essential for posture and functional movement.